Good morning, everyone. My name is Christian Morales, and for my biology signature assignment project, I chose the topic soft tissue sarcoma. To begin, you may ask yourself, what is soft tissue sarcoma? Soft tissue sarcoma, or STS for short, is a type of cancer that affects the soft tissues of the body and starts as a growth of cancerous cells in the soft tissues, which include the muscles, tendons, or fat, for example. And despite there being over 80 different kinds of soft tissue sarcomas, it is quite rare. It's able to develop anywhere within the body, and it's mainly found in the arms and legs with a 43% rate, and most others are found in the abdomen and chest area. Moving on to slide 3, we'll take a look at the multiple risk factors that can cause soft tissue sarcoma. First, for genetic risks, certain genetic mutations can contribute to the development of soft tissue sarcoma. For example, sarcomas like liposarcoma and angiosarcoma are linked to mutations in the TP53 tumor suppressor gene, as well as areas where lymphedema has developed. And rarely, soft tissue sarcoma can have familial ties, with certain genes having dominant or recessive inheritance patterns. Next, environmental risks, such as being exposed to high doses of ionizing radiation, certain chemicals or substances like dioxin, or having gone through previous radiation therapy or chemotherapy for other cancers can cause soft tissue sarcoma. Then, development of soft tissue sarcoma isn't known to be correlated to behavioral risk factors like injury or lifestyle choices like smoking, diet, or exercise. Lastly, AI models for risk assessment are currently being used to classify the 5 most common types of soft tissue sarcomas by using the study of tissue structures. Looking to the bottom right, we can see the data from the deep learning machine they use to help predict the survival rate of leiomyosarcoma patients. Now that we have a gist of what soft tissue sarcoma is, we can start to go over the demographics and statistics of STS and see who is most likely to develop STS and the incidence and prevalence of STS in the US compared to the EU. Soft tissue sarcomas can affect people of all ages, but 40 out of 100 cases of STS are most commonly diagnosed in adults age 65 or older, and 10 out of 100 cases of STS are diagnosed in adults age 30 and younger. Next, the incidence rates for STS in the United States are about 13,400 cases per year, with 7,400 cases being male and 6,000 being female, with the prevalence rate of sarcomas occurring being 2 to 4 people per 100,000 people in the US. Then, the incidence rates for STS in Europe are about 27,908 cases per year, with prevalence rates of sarcomas occurring being 3.3 to 4.7 people per 100,000 people in the EU. Next, I'll be going over the anatomy of soft tissue sarcoma, and we'll take a look at the primary organ systems, organs, and tissues affected by this cancer. Soft tissue sarcoma is a rare cancer that can form in any part or organ of the body due to the fact it affects the soft tissues that connect, support, and surround the organs, bones, and more. It is most commonly occurs in the extremities of the body where muscles, fat, blood vessels, nerves, tendons, and the lining of the joints are located. Depending on where in the body the sarcomas are located and their start location, it can either be classified as leiomyosarcoma, which develops in muscle tissue, liposarcoma, which develops in fat tissue, angiosarcoma, which develops in blood or lymph vessels, and many other types of sarcomas. When and if the cancer spreads from its active site, called the metastasis, its cells will always travel through the lymphatic system or circulatory system to form a metastatic tumor in another part of the body, infecting a different organ system with STS. Now, we'll take a look at the physiology and symptoms of soft tissue sarcoma. Since STS originates in the soft tissue which supports and connects the body together, it disrupts the body's normal physiological functions like movement, for example. Signs of STS in the body involve uncontrolled growths of cells in areas with soft tissue on the body, which often manifests as painless lump or swelling, which we can see here, what it looks like. This growth of cancer cells disrupts the soft tissue structure and functions depending on where it develops, leading to symptoms like pain or tenderness, new lumps or swelling, limited mobility, blood in stool, and more. These symptoms occur when the sarcoma grows in size and begins to press on nearby organs, muscles, nerves, blood vessels, and more. If not treated, long-term, soft tissue sarcoma can potentially spread to other parts of the body or advance in stages, leading to a reduced rate of organ function and survival. Overall, the survival and mortality rate of soft tissue sarcoma varies based on the stage, type, treatments used, and spread of the disease, but typically the survival rate is 65% 5 years after diagnosis, and the mortality rate is 12% within a year of diagnosis. Last but not least, I'll be going over how to diagnose and treat soft tissue sarcoma in the body, and how AI is used to help aid this process. Soft tissue sarcoma can be diagnosed with a variety of imaging tests such as X-ray, CT scan, MRI scan, and PET scan, or it can be diagnosed through a procedure to remove cells for testing called a biopsy. Current treatments available to help fight off STS are surgery, radiation therapy, chemotherapy, and targeted therapy, two of which we can see examples of on the right. Mohs surgery is a common treatment that aims to remove the tumor and some healthy tissue, and radiation therapy uses a machine that directs beams of X-rays or protons to specific points in your body to kill cancer cells. Third, chemotherapy uses strong medicine to kill cancer cells, and lastly, targeted therapy uses strong medicines to attack specific chemicals in the cancer cells to kill them. The side effects and risk will vary based on the treatment type, but people typically report nausea, fatigue, hair loss, etc., and risks may include organ damage or failure, infection, or long-term complications. Although soft tissue sarcoma can be cured, it also has the potential to come back after it has been treated. Lastly, hospitals are using digital pathology based on AI and algorithms to improve diagnosis of STS tumors in humans.